Hi, my name is Scott. About a year and a half ago, I started to have this tingling sensation down my arm. I didn't know what it was, but it created this tingling sensation that's pull my arms down. I went to go see my doctor, and he recommended that I see a neurologist because it looks like it has something that's impeding on my spine. So we took an MRI, and the MRI showed that I have a bulging disc on my C4, C5, C6. And in that, the disc actually pushed against my nerve. So I went to go and look and search for an orthopedic surgeon, a spine specialist. And they looked at the MRI and they told me that the only way to fix it is to get disc fusion, is basically removing my disc and fusing my spine together. That didn't set too well with me since I'm only 20 some years old, and it's something that can reoccur later on in life. Also, it may impede on my physical activity. So at that point, I actually went to a physical therapist. For 4 to 6 months, he took a conservative approach, just doing certain exercise to help strengthen my muscles, to help relieve some pain. However, after 4 to 6 months, it got better a little bit, but it wasn't quite where it was. I wasn't able to pick things up still. My shoulder is tight all the time. I've always had the tendency to pull to the left a lot because my right is real tight. There's always a bulging. Looking up, I can't look up for the longest time, for about a year, because every time I look up, a few seconds later, my whole arm, this tingling sensation. It's like your arm falls asleep. Even after some treatment, that tingling sensation is still there. Even just picking things up, my arms just numbs out, like it falls asleep, and I just try to pick up things and it just gets really heavy, and I just have to stop there on the spot. This is just after a few seconds, it's just bending down. Even when playing softball, I'm an avid softball player. When I throw, my body has a tendency to compensate for my natural throwing motion. Therefore, it's not quite the same as I used to throw. And I even noticed the difference in the motion and the strength and the whip. I lost that whip for about a year and a half or so. When I came to this office, after searching for this spinal decompression program, I didn't know what to expect. After being through physical therapy, their approach was very more conservative in not focusing on my area, rather than areas around it to help strengthen it. But this was more of a to-the-point approach. His program is more focused on exactly where the pain is. He did treatments as in focusing on my spinal area, stretching out the muscles, relieving some muscles. He did some massages, some spinal decompressions, and put me on the traction machine, and those kind of things help relieve some pain from that area of my spine. After 2.5 weeks of treatment, I started to feel better. My numbness was practically gone. I'm able to throw, gain full strength in my arm, go back and play softball, lay on my belly and then watch TV or being on a laptop while lying down. Those kind of things I couldn't do before. Now I can actually do that and more. Having that pain and numbness, I always have it in my mind. It'll always create that limitations for myself to do certain things. But after the treatment itself, one of the big relief is not having to worry that you can't do certain things or you're limited to certain things because of this pain or this numbness itself. After going through this program, I would definitely recommend anybody who actually has the same kind of symptom. It was tough for me. It took me about 1.5 years to find this, but it really works. It really works. After 2.5 weeks, I started to feel better because it was more focused and more intense. Going through this kind of symptom, it's there's no one magical pill that would help solve it, and that wasn't what I was looking for. The only way to treat it is through intense physical therapy, and that's what this program offered.